Dr. Marianeira, welcome to the Climate Pod.
Thank you.
You have been the director of the Department of Public Health and Environment at the World Health Organization since 2005. Why is the WHO concerned about climate change as a public health problem?
Thanks for the question, because in fact, if you look at the causes of climate change and how climate change is affecting our health, here is the answer. I mean, we are concerned because climate change is touching and putting at risk all the main pillars of our health: our food, our air, and our water, and of course, in addition, our shelter, and creating more diseases. So if you touch the pillars of our health, of course, the World Health Organization needs to be concerned, particularly because we see this as a kind of opportunity as well. If we stop those reasons for generating global warming and greenhouse gases emissions, the opportunities for global public health are enormous. The health benefits will be fantastic.
How does the World Health Organization work with countries to address climate change and air pollution problems?
Thanks for making that link with air pollution. I think it's extremely important, and maybe we should start the conversation with that. And this is one additional reason why WHO is so concerned about climate change. When you look at the causes of climate change, one of the most important one is the combustion of fossil fuels. And this combustion of fossil fuels is as well responsible for a big proportion of the air pollution we are suffering at the moment. So for us, it's the same agenda. It's always about health. It's how our health is affected by this pollution caused by using fossil fuels that probably we need to stop using it. So WHO, how are we facing this? Well, in different fronts. First, of course, we need to produce the scientific evidence that we need to prove that there is an important linkage between climate change, air pollution in our health. And on that, I think I can say with quite confident that we have thousands of papers, scientific papers and evidence, and WHO has been working for many years now on demonstrating those linkages and how air pollution is affecting our health and killing every year 7 million people. Second, with this scientific evidence, of course, you need to do recommendations. You need to make sure that the countries know what to do about it, how to address the causes of this air pollution, and how to respond, what are the available interventions, what are the opportunities, what are the tools they have, what are the mechanisms, and how to learn from other countries or other governments that are doing already, taking action and is working. So we put all those policy recommendations for our audiences. Third, we need to raise awareness. We need to make sure, and thanks for this opportunity, because we need to make sure that people understand that this is a health issue, this is a health threat, this is a health opportunity. It's not just a question of, our glaciers or our lovely bears and a polar bear and the future planet. No, it's about our lungs right now, today, and our children, not the next generation, only this one as well. And I think this sense of urgency and the fact that this is so much related to health, we think that this will motivate more action on stopping the causes of climate change. Then we need to mobilize the different communities. We are trying to put, contributing to all of these, creating big networks with the health community at large. Of course, those are our kind of normal partners, but we need to go beyond that, because the decisions about the sources of energy are taken by different ministers, ministers of transport, ministers of energy, ministers of development, industrial. All of those decisions are not taken by the health sector, but the impact of those decisions, for good or for bad, will be very much felt by the health community. So we need to ensure this intersectoriality and work with any agency or network or groups on transport issues, on energy issues, on urban planning issues. So mayors, we mobilize any network that might have an impact or an opportunity to move positively this agenda. And then we need to make sure that we prove that those interventions are implemented, they have a good results, and we quantify the health benefits of taking this action. So it's a big thing of mobilizing the scientific community and beyond, and the society, and proving that if you do that, the reduction on the number of deaths and the improvement on the health conditions of the people will be huge, and it will be good for the economy as well.
Yeah, that sounds like a ton of work, and it's incredibly necessary because, as you said, air pollution is extremely deadly. 7 million deaths a year is an astonishing number. I mean, we are right now in the middle of the COVID-19 pandemic, and there have been about 4.5 million deaths worldwide due to COVID-19 over the last year and a half. But why do you think we rarely hear about the death toll from air pollution like we hear about deaths from other diseases?
That's a question that I asked myself several times a day, and I still don't have the answer. I mean, you will expect that when WHO will say there are 7 million premature deaths caused by exposure to air pollution, we need to reduce air pollution, this is literally killing us, you will expect governments to react with even panic and taking immediate decisions, and that the citizens putting pressure on their governments to do something about that. But it's not happening. It's like tobacco, you know that tobacco is killing 7 million as well, or 8 million now. And well, it's a kind of acceptable death. Tobacco, we did a tobacco framework convention, is one of the good winners on public health, even if we still have so many deaths. But you can always say, well, it's a behavioral issue. The society is pushing you as well. But at the end of the day, people might say, well, it's my choice. But air, the quality of the air you breathe is not your choice. If you live in certain cities around the world, if you live in New Delhi, in Mexico City, in Shanghai, in Beijing, in name it, because there are so many cities that are very, very polluted, you are exposed, whether you like it or not, whether you are rich or poor, you are exposed to a level of air pollution that is not respecting the standards proposed by the World Health Organization, and keeping 90% of the world population breathing air that is not respecting those standards. Of course, if you are in a rich country and a very developed one, maybe you are just a little bit below the recommended standards. But if you are in big cities in developing countries, then you are sometimes even 100 times above the recommended standards. And this is a problem for our health. So why are we not reacting? I don't know. I'm frustrated anytime when I repeat this figure and I see that, well, it's called the invisible killer. People doesn't realize that without breathing, we will be all dead. So it's something that we cannot stop doing. But for some reasons, it's somehow a little bit acceptable. And we need to change that now that we need to recover after COVID-19 and we need to change certain things. I hope that we will have this opportunity that we have been waiting for, and stopping air pollution not only will reduce the deaths associated with the pollution, the polluted air we breathe, but it will generate better environments for having a more healthy lifestyle and reducing chronic non-communicable diseases. We can interact in our cities and therefore better mental health. So we will change completely the environment where we live for good and for protecting our health and promoting our health. And that will be good for the economy as well.
None of the 7 million deaths resulting from air pollution are acceptable. And it's especially tragic when you learn about the death of 9-year-old Ella Kesey Deborah. And like you said, she didn't have a choice in the type of air that she breathed. And in 2020, a London coroner ruled that the cause of death of 9-year-old Ella was air pollution. And this was the first time this has ever happened in the UK. What do you think will change as a result of this case?
Well, first of all, our strong support to Ella's family, her mom, for her incredible battle to reach the interest and the final conclusion on this case, and recognizing the coroner, the air pollution as a cause of death in the death certificate. For us is painful, of course, because it's a little girl that was somehow leading this unnecessarily. But there are so many Ellas around the world that are suffering horrible asthma attacks. And this confronts us as well with something that we see every day, which is I'm a medical doctor by training. So as a doctor, you will receive a patient and you will do your best to treat that patient who is suffering from a disease. But more and more, we need to do that. I mean, when the patients are sick, we need to treat them. But more and more, we need to be aware as well of our role on making sure that the people is not sick. I mean, we were treating Ella and other Ellas around the world on their horrible asthma attack, but we were sending them back to breathe the toxic air that was the cause of her disease. So this is something that we need to change on our medical training as well, that we need to invest a lot of our energy on prevention, on primary prevention. And primary prevention means things like that. Obesity is a major health issue. So we need to make sure that the kids will have the opportunity to do physical activity. And this is, again, very much linked to the issue of air pollution. If you prepare your city for having a space to walk, to breathe, you remove the traffic, you reduce the pollution, and at the same time, you will have plenty of health benefits. So this case of Ella in the UK is quite historical, and definitely we will use it with all due respect and all of that to mobilize more action and to say that there is much to do as well in terms of legislation. Our dream will be that one day the WHO standards for air quality will be kind of endorsed legally and will be mandatory. That will be a kind of framework convention or something on air quality, which is incredible because, you know, we have a standards for the quality of the water we drink or the quality of the food we eat. We have food safety standards. So why not standards on the air we breathe? We breathe so many times a day, more than 10,000 liters of toxic air will get into our body in and out every day. So maybe we need to do something about that more seriously and consider that the air we breathe is as important, if not even more, than what we eat, because we can't stop more than 3 minutes breathing, while we can eventually survive without eating for maybe 3 weeks, but and 3 days without water. But if we stop breathing, it's the end of our life. So we need to be more demanding on the quality of the air we breathe, and all of that is so much connected. So we will use this case with the permission of the family in the UK. I think it was a very good demonstration that when you have commitment and you have the right arguments, you can win incredible battles.
Yeah, well, we know such air quality standards work. I mean, governments have taken action in the past to regulate air pollution. London's Public Health Act was passed in 1891, and that worked. So did the Clean Air Act here in the United States, which was passed in the 1970s. Policymakers know the problem and they know the solution works. So why do you think more hasn't been done to restrict or even eliminate harmful air pollution?
I think probably the economic argument and the development argument has been used wrongly. I mean, for certain time, the argument of you need to pollute if you want to develop economically has been used. And even some countries were saying, oh, I cannot stop my emissions rate because I need to develop. And you Europeans, you did it. So now you cannot stop me to do it. This is, with all due respect, but I think it's a nonsense argument. I mean, first, I think all countries should learn from the bad experience we have in Europe I grew up in a city in the north of Spain where coal was very much extracted and a source of economy, and it was a bad economy. We end up with a lot of problems related to this exposure to coal combustion. And in any case, that economic development was non-sustainable. So then we have subsidies. And anyway, so the economy went really wrong on that. And you need to go on a transition. So why not to learn from those experiences in Europe? Everybody remember London so polluted that but now you look at the Scandinavians, they are very well developed economically, and they are not polluting their environment and therefore their health. So I think those models exist, and this argument that if I want to develop, I need to pollute are wrong. I think even China is now very much aware of that this is not a good economic argument anymore. You have many big multinationals or big CEOs that they don't want to live in certain cities in China because they are afraid of their health and then the fact that they cannot breathe, New Delhi and others. So I think maybe it was one of the reasons was this economic wrongly used argument. And maybe the other one is that people doesn't see it. I mean, you see it in places like Beijing or New Delhi. You even feel it and you taste it, your air pollution. You at the end of the day, you have a terrible headache, your eyes are irritated, your throat is really suffering. And so you start to feel it. And of course, if you are asthmatic or you have a precondition, a health precondition, then you will be really a strong advocate. But we need to make sure that people is aware that even lower levels of pollution are good for their health, and then start to use this health argument to push on more action on climate change, and therefore the results of this action will benefit enormously by reducing the levels of air pollution and therefore contributing to our better health.
Well, this is the Road to COP26 series. So we want to understand what the World Health Organization's goals are for the upcoming event. But first, let's talk a little bit about the history. Has public health been addressed at previous COPs?
We started from a very, it was a kind of, dry area. We started very hard on attending the COPs. And I remember at the beginning, people were looking at us. We were always using the health argument and saying, well, this is an opportunity as well. While you don't use the health arguments to motivate more action. We were quite alone at the beginning. I think we started to go 15 years ago to every COP and mobilizing and trying to influence and putting our documents and our scientific evidence. And we were quite not marginalized, but our arguments were taken not very, on a separate, because for them it was the negotiation and it was the environmental treaties and it was the action. So of course, health will be benefited, but you don't need to use that. Little by little, I have to say that things are changing. And I have the impression that this year, this COP, the Glasgow one, health will have a very prominent role. For the first time, we will have a health pavilion, which is incredible, but and we will have our document, our report called the health argument for more climate action that we will be presenting as WHO, as the World Health Organization, together with as many public health related or indirectly related networks, groups and associations that wants to join that report, where we say, okay, this is the opportunity to reduce vulnerability to a potential new pandemic or emerging infectious agent, because the prescriptions we are making will be reducing that probabilities of a new virus to emerge. because we are proposing to stop destroying ecosystems and deforestation, aggressive deforestation, and then very aggressive agricultural practices. We propose a more sustainable food system. We propose a healthy urban planning with different public transport systems. We propose to stop giving subsidies to fossil fuels for health. We propose to do a transition, a quick and ambitious transition to healthy energy sources and renewable, clean, and we are providing plenty of evidence of that. And what we are saying is that people care about their health. I think the pandemic has demonstrated that incredible actions are taken in the name of health. So if they see the connection of climate change through their health, which might not have been the case in the past, but now they will see it through the air pollution, for instance. We are bringing the 7 million deaths to the table of negotiations of climate change. And this is the opportunity to tackle climate change, air pollution, potential for new pandemics, and makes a lot of sense because the health benefits will be enormous, the economic benefits will be enormous, you will have green jobs, and it will be a fair and justice for those who are at the moment more vulnerable and are the ones that are not contributing to this problem, if not on a very, very small proportion.
Yeah, as you mentioned, health is a COP26 priority, and the WHO published its COP26 health program earlier this year. One of the initiatives of the WHO COP26 health program is climate resilient health systems. So what is the goal of this initiative?
Yeah, you know that we are focusing very much on mitigation, on stopping the causes of climate change, but at the same time, we need to focus as well on adaptation because many health systems, many countries, many vulnerable populations are already very, very much affected by climate change. I think everybody heard the IPCC report a couple of weeks ago, and so dramatic predictions. So this is time to do something. So systems can do something. First, they need to be better prepared, so be more resilient to climate change, be more prepared to cope with the impact, the negative impact of climate change. So we are proposing different actions for having healthcare facilities, health systems which are more resilient, means better management of water resources, of the use of chemicals, on responding a better epidemiological surveillance for those diseases that will be caused as a risk factor by global warming, vector-borne diseases, and be prepared on knowing that climate change will be affecting them, be having more training the health professionals, and be ready to, with the minimum resources that they are having, because they are very limited resources that are going to the health systems in terms of climate change. So they need to cope with that. And our health systems needs to be more resilient. And the other initiative is about the health system, obviously, of the more developed countries, the rich countries, those that are already contributing to the greenhouse gases emissions. How can they contribute by reducing their own carbon emissions, and on their procurement, on the use of plastics, on the use of waste management, on the use of the chemicals and then disinfective material at the healthcare systems, at the health system. So there are many contribution and leadership that the health community can provide. And we hope that these two specific initiatives will be joined by many. And then I think the health sector will take leadership on this climate change agenda to accelerate a little bit action. Otherwise, I think in the name of health, we can promote more action, more ambitious, and more speed, because, you know, we have been discussing at COP for 26 years, actually 27, because last year it was not a COP. So I think it's time now to say, okay, if the environmental arguments were not strong enough, let's now look at the health arguments, and therefore public health will require a different speed that climate change, environmentally related, have been demonstrating until now.
Well, many parts of the healthcare system are private, especially here in the United States. Are you asking private companies to make the same public commitment to decarbonize?
Absolutely. I mean, we need any health system and then to lead by example, to have a good corporate social responsibility, to lead by example and providing the leadership. And of course, the private sector needs to play a good role. We want to look at the procurement. We want to look at the distribution. We need to look at the transport of the different items and go as far as the recycling or the incineration. In many places of the world, there is still incineration of health-related materials. So we need to change all of that. And the private sector, they need to prove that they have the resources. And of course, we don't want greenwashing. I mean, these days, everybody's jumping on the climate change and saying we are doing this to reduce our carbon footprint. I think it would be good to have a strong monitoring and no greenwash. It has to be a real one. And in terms of more resilient healthcare facilities, I think we can measure it and we can use good models and give visibility to those good models to stimulate others to follow and even create a healthy competition. Why not?
Well, in that COP26 health program, the WHO has asked countries to commit to a health national adaptation plan. So what are these plans and how should countries create them?
Okay, you know, in the climate change agenda and negotiation, there is what is called the NDCs, national determined contribution, where countries on a voluntary basis, they say what they do for tackling the causes of climate change. For us, it would be great if first people is aware of that. So I will invite any one of the listeners to, if they are from Australia or from Spain or from UK, have a look at what your country is committing to do and make sure that as a good citizen, you put pressure on this to be not only announced, but on a very transparent way, executed. And even if instead of 2050, it can be 5 years before, it will be very good. I mean, it will be, there is no reason why we cannot be even more ambitious in terms of health. And again, in terms of health, is not very well represented in the national determined contribution. We have been looking at that. We did a report. We check it, and health is used as an argument in the narrative. But then, when you look particularly at the funds allocated for health, is still very, very, very small proportion of those funds. So I think if we do the other way around, if we put health as the argument and the health, and if we quantify the health benefits, that the number of lives you are saving if you take certain measures, I think that could be a very strong motivation, a good engine for more action and for even checking the way countries are executing that, because it will be on a positive way. You will see that the positive results or your actions on climate change will be measured on health benefits, and nothing motivates people more than their own health.
The World Health Organization says that only 50% of countries have a national health and climate change strategy. So what do you think is holding the other 50% of countries back from implementing such a strategy?
Well, health has not been very much present at the climate change. You know that in many countries, the Ministry of Health is not the strongest one among the members of the government. And is as well, this is one reason. The second reason is that the health sector, sometimes it tends to go only to the curative part. I mean, concentrating on when the people is already sick. So they concentrate on needs for their hospitals and needs for the curative part and less on the prevention part, on the influencing how other sectors by their decisions will influence the outcomes for our health. So it's probably that the health sector has not been well represented, has not been attending very much the COP conferences. If you look at that, normally there are ministers of foreign affairs, ministers of environment, ministers of economy or presidency, but it's very rare to see ministers of health attending. That's why WHO has always or very often organizing big events, and even this year we will have our global conference on climate change and health in the middle of the COP, because we need the health sector to be aware, to understand the issues, and to be able to influence and do the national plan on health and adaptation and climate change. So there is a lot of effort here, but I'm sure that the health community this year will exponentially increase their influence on the climate change agenda, or at least I hope so.
Well, you had mentioned earlier that nearly 90% of the people around the world live in areas that don't meet the World Health Organization's air quality targets. So what are those air quality targets?
Well, you know, we have targets for PM 2.5, PM 10, and NOx and others. And at the end of September, I cannot announce yet the exact day, but we will launch the revision of those air quality guidelines. This is generating a lot of expectations and a lot of interest, and I hope that we will be responding to the needs of the world, because we have been working on those guidelines for a long time with the best experts around the world, and our recommendations will be, I hope, endorsed by as many people, as many countries as possible. We will be so happy. Actually, in order to say whether a country is respecting the levels of air pollution or not, of course, we use it as a reference, the air quality guidelines of WHO. That's a good thing, but we need to create some mechanisms for countries to voluntary or mandatory, but express their willingness and their commitment to reach as far as possible and as ambitiously as possible the standard recommended by WHO, because there are no safe levels of for air pollution. I think it should be the air quality what we need to measure. So we need to ensure that our governments will take this as a priority and then link it to the climate change, and then being able to report back to the countries on how many lives we could save by improving the quality standards of air, and how much cost as well, because at the moment treating the chronic diseases caused by exposure to air pollution is a cost that has never been included in the negotiations of climate change. You know, the externalities of treating patients and diseases caused by exposure to air pollution will definitely represent such an incredible investment that will cover the cost of any action that you need to take to mitigate climate change. So this is not anymore an argument saying that tackling the causes of climate change is very expensive, because we are paying even more to treat and maintain and the health systems needed to cope with the diseases and the cost of those diseases caused by exposure to air pollution, in addition to the life of the people that have no cost, of course. There is no, I mean, not enough to calculate the cost of a human life.
Well, where has the WHO seen the most success in moving countries or states or even cities to do more to reduce air pollution?
Well, we see some examples of mayors around the world that are taking measures and that are very conscious. I think one of our probably more powerful tools is the fact that we did that global conference on air pollution and health, and we have those maps proving where around the world, what are the most polluted cities. But again, we do not stop this there. We prove that there are interventions, we have tools, we have plenty of materials, we have advocacy that needs to be used. So it will be great, as I say, if countries start to commit publicly to reach levels of air quality that are very much aligned with our standards. And I think a success as well is the fact that we have created this platform on energy and health, on the SDG 7, the access to clean, modern, and accessible sources of energy. And WHO is more and more infiltrating all of those areas where we were maybe not expected. I mean, people will expect WHO in the SDGs 3 about health and well-being, but if we do not reach the SDG 7 about clean energy, or the SDG 6 about water, or the one on urban planning, our health will be, or the food systems, our health will be very much at risk. So access to energy, this platform on energy and health, making sure that we will facilitate access to clean fuels for cooking, lighting, and heating for these almost 4 billion people around the world that are not using electricity, and then the easy click that we do in our world to cook. They need to collect the wood, they need to do an open fire, they are exposed to the incomplete combustion of those fuels, and then allowing those toxic material to get into their lungs, and from the lungs to the rest of the world, so the body. So I think is pushing this agenda on clean energy and renewable energy is as well one of the places where we can have a strong success.
Well, if our audience would like to learn more about what you're doing or what the WHO is doing to reduce air pollution and combat climate change, where should they go?
They have, I will invite them to have a look at the WHO website, of course, on climate change and air pollution. Please be very much aware of what exists and what are the arguments. You have very good evidence there. Be an advocate on your environment, wherever you live, on a small city or a big one, or you are a big influencer or a normal people. Any of us, we can do it. Then try to have a good model of your own way of consuming, recycling, and be a good citizen. Use public transport whenever it's possible, in particular if it's a sustainable one. Be conscious of the need for energy efficiency. Be very conscious of the use of energy, electricity, when it's produced by other sources that are very polluted, and make sure that you participate on those political fora. These days, with the social, you can be present in COP26, even if you are not in Glasgow. There are many ways to raise your voice and join WHO on this report at COP26, the health argument. There is an open consultation until the 25th of August, so you are all invited to go there on WHO, the health argument. And if you want to join that report as a kind of creating this pressure from the health community in a broad sense, you are very much welcome.
Well, Dr. Marianeira, thank you for all that you have done in your career to raise awareness for air pollution and climate change problems, and for helping billions of people around the world improve the quality of the air that they breathe. And thank you so much for joining the Climate Pod.
Thank you. It was my pleasure. Thank you all for the opportunity.